Hello? I was recently admitted from hospital after being a guest there for over 2 weeks. I had been admitted because I had been suffering in silence at home for roughly a week in constant irritable pain of the lower leg near the region of the ankle. I was having great difficulty getting any sleep and had next to no appetite or energy for that matter. I was reduced to staying in bed for the majority of the day, with little to keep my mind off the pain. I had visited the accident emergency outlet of the hospital on the Monday, after getting injured playing football the Friday before. However, after I had explained my case to the nurses, they had sent me home believing it to be ligament damage and advised me to take some mild anti-inflammatory painkillers. It didn't take long for me to realize they were not having the desired effect, and I was growing more and more frustrated with my condition. After staying in my room the next few days, waiting for the pain to subside, I realized it was just getting progressively worse. My skin near the injury had been getting very red, swollen, and hot to touch. Ice packs had little effect, and in fact often just made the discomfort more noticeable. I sought help at my local general practitioner on the Thursday, and he gave me an injection for pain relief and prescribed me some slightly stronger painkillers. He advised me to return to the hospital had the pain still been unbearable the next day, and it had, so I returned. I arrived at A&E again on Saturday, and sometime after I was called into the nurse's office. She took one look at it and diagnosed it as cellulitis. I thought that her diagnosis had been somewhat premature, but I later realized she was absolutely correct after having conversed with the doctor. Even still, their painkillers were not strong enough, and after having injected me with a new solution and finding out that it was not sufficient, they then had to resort to something even stronger, and even then, the pain relief was only temporary, and at best, mediocre. They brought me into another room, where I met a young surgeon who confirmed it as cellulitis. I was then informed I would not be going home, at least for the time being, and I was put on intravenous antibiotics. Finally, I was offered a ward, where I would be staying indefinitely. So I thought it was best to get familiar with my surroundings, as I would likely be isolated to this immediate area for an uncomfortable amount of time. It took quite a while to grow accustomed to my new home. I was put on 2 different types of intravenous antibiotics, hooked to a drip for the next 2 weeks. Initially, I found the first few days quite difficult, but I knew I had nowhere else to go and could not leave, so before long, I accepted my fate. The hospital food was mediocre. Some of the meals were actually quite nice. Others were barely edible. I was growing quite irritated because I was continuously being served tea, and no matter how many times I told them I disliked tea, they kept serving me it. The surgeons discovered an abscess on my ankle, so they cut it out. I was given local anesthetic for this, although the first dose was not powerful enough, possibly due to constricted blood flow. I had hematoma as well, which is a localization of blood outside the blood vessels. I believe the blood becomes quite congealed, like semi-solid or thicker. I was still in quite some pain and discomfort, as they had not given me enough painkillers. So I was administered morphine, which was the second time I had taken morphine in my life. I wasn't given enough painkillers during the procedure, and it was not a nice feeling. So I was administered morphine then, which was the second time I had taken morphine in my life. The first was last year. It's a great feeling, a sensation of total tranquility and peace. The generalized surgeons performing the procedure later informed me there had been a lot of pus and debris emitting from the infected area. The debris, I believe, was millions of dead cells who tried to fight off the infection. There was a massive gaping hole in my leg, basically, almost right down to the bone. It looked off-putting, to say the least. It was definitely not something the average human would wish to see, especially on their own body. After the surgery, I needed daily dressings on the open cavity that was significantly large, covering a large portion of the center of my upper ankle. I was relieved that at least it was not visible for most of the day. The only time it could be seen to the world was when the dressing had to be changed. I felt kind of insecure about it because it was obviously a bit unnatural and not something I expected I would get at any time in my life. My leg was initially soaked with the betadine solution, the purpose being it worked as a disinfectant to the leg, but this was only temporary as it was causing some irritation to my skin. A rope or wick was used to cover the cavity, and my medical team explained to me it was to ensure the wound healed from the inside out. A large cavity underneath the skin was not their wish and would not be ideal. I, of course, was aware I was not an exclusive VIP in the ward I was in, although I was probably, or almost definitely, the youngest person, I'd say by about 45 years, barring maybe one exception. The surgeons came to examine me every day or so, and sometimes the consultant whom I was under the care of was accompanied them. I could tell these people knew what they were doing, but unfortunately they did not specialize in my condition. Because they were general surgeons, and I would preferably be put under the care of an orthopedic surgical team, as they specialize in conditions similar to mine. Unfortunately, in the hospital I was in, there are only 2 surgical teams, and they're both teams consisted of comprised of general surgeons, and they don't really specialize in illnesses of the bone. They would leave that to orthopedics because that's what they're qualified for. I was sent for a bone scan, sorry, in a different hospital, a larger one, closer to the nearest city. It's kind of more technologically sophisticated to the hospital I was in. It has a bone scanning machine. I'm not sure if it's actually called that, but it's different from an X-ray. Quite a lot different, but they would, the same people would be operating on both of those, the X-ray and the bone scan. People who are qualified to do an X-ray are also usually qualified to do a bone scan. So they would kind of interchange between the two. I was driven there and back by an ambulance, and I asked them many questions as I found their line of work interesting, but definitely not something I would want to do myself. After drinking a radioactive fluid after I had arrived at the hospital, I then had to wait roughly 2.5 hours for them to complete their scans. It was quite a long process actually, and the radioactive fluid, I was given, they advised me not to go near pregnant women or young children. I think just to be safe, just to ensure that I might not cause any unwanted effects on the unborn child or the young children. I think they're more susceptible to radiation. I hope the results will come back negative. I did not want to have osteomyelitis. Osteomyelitis is an infection and inflammation of the bone, and it can be quite severe. Oh, water is so nice. Finally, sorry, after the 2 weeks I was sent home, only to be readmitted in the following couple of days. as unfortunately the bone scan came back positive. I had osteomyelitis. I wouldn't say I was devastated, but I was definitely disappointed and very frustrated because I did not want to, I had no wish to return to the hospital because I found it to be kind of a dense, kind of dreary atmosphere. Depressing, actually. It's not something that you would want to experience. It wasn't exactly a good time in my life, but thankfully I'm out, at least for now. Originally, they said I was to return for another 2 weeks, but they had changed their minds, and I was pleased when I found out their plan. I would put on oral antibiotics for 4 weeks. That was the first course, and of course if that had not been effective, they probably would have put me on some oral antibiotics for another period of time, or maybe tried another method to kill off the infection. Throughout this ordeal, I tried to remain emotionally detached, but the reality of my situation was starting to seep into my thoughts. I'm not going to go into too much detail about my experience, but I saw some very elderly people in the hospital, some with severe deteriorating illnesses that was gradually affecting their minds and leaving a very lasting impression upon myself. I definitely don't ever want to be in that situation where I'm utterly reliant on other people for my every whim, and completely dependent on the aid of others just to get through the day. I don't think I ever want to be like that. I don't know if it's a sense of pride or the dreaded feeling of helplessness that would put me off from ever being like that. I don't know. I hope I'm never. I hope I can keep a part of myself. I can stay whole, and I'll never have to watch as my brain and my mind and the part of myself that makes me slowly wash away. That would probably be my worst nightmare. I want to remain who I am with my thoughts and ideals and my hopes and my dreams and my interests. I want to stay complete for as long as possible. It was honestly an extremely unpleasant experience, but I did feel grateful that I was not in their situation, and I also felt a great deal of sympathy for them. There was some amount of people that passed away in my time there. After watching their grieving families mourning their lost loved ones, that was something I will never ever forget. Cellulitis can have lasting or fatal results. My hematoma had been treated, and I felt a physical and mental improvement after these two completely separate but also linked illnesses had been combated. I was worried about the infection reoccurring and the results of the bone scan, and the results of the bone scan had inflicted some feelings of despair, but for the first time in what seemed like literally forever, I was feeling quite confident. I know it wasn't over yet, but I was feeling optimistic for the future, and I know I will have some people I can rely on for emotional support, which makes me lucky. Some people only really have themselves. to rely on for anything, and they don't have anyone else to talk to or help them with whatever problems they might have, and they have to deal with it themselves. And I don't think I could live like that. I don't think I would have that sort of strength and willpower to go on every day on a continuous basis of living that sort of lifestyle. I'm quite privileged to have people in my life that care about me, even though it's not everyone that I've met. It still is enough. So I have a sense of gratitude for that. In conclusion, I would like to voice my appreciation for everyone that helped me and showed concern for me throughout this torrid ordeal. Sorry, I fail at English sometimes. I met some people that I quite liked, some of which I befriended, and some of whom aren't here anymore. There was a couple of people, one in particular, person that I met that I quite liked, and it wasn't nice watching his deteriorating condition, and his illness was very aggressive on his body, and he was on very strong painkillers, so he reduced the feelings of pain, but he wasn't very perceptive or aware of his surroundings, and I think he was hallucinating to some degree, and the medication he was on was also having some unwanted side effects, and unfortunately I had to witness some of those side effects, such as nosebleeds, and I could tell it was affecting him, but he's not suffering now, and that's a good thing. All in all, I would go as far to state that this has been a life experience for me, and a reminder to take nothing for granted, and to appreciate what I have, while also maintaining a sense of empathy for people less fortunate than me. Thank you for watching. Take care. One more thing. This of course explained my recent absence, and I have not been able to make as much videos as I would have liked to. My illness took a lot of time out of my schedule, and it kind of postponed all the plans I had on making videos or whatever, so I hope I can return to it soon. I mean, the entire month has gone by. I've been suffering from for over 5 weeks from this, and I think I'm over the worst now, and I think my condition is improving. So I'm quite relieved for that, and hopefully in a few weeks things will be back to a relatively normal pace. Just hanging in there, just about. So no, I'm actually doing quite well, so just I'll continue my recovery process, and try to keep my mind occupied at the same time, simultaneously, while also maybe seeking out a new something new and interesting to take my mind off things and consume the hours of the day, while also keeping me interested and maybe educating me. I might learn a new language, or maybe do a course or something, because this past year or so I haven't been doing much, and I don't want to be doing this for the rest of my life, of course. I do have some degree of ambition. Also, I'm quite pleased that I'm home now, because the hospital was my experience in the hospital was slowly becoming more and more tedious. So I'm glad I'm out of there. Hopefully I won't have to return, and hopefully I'm wishing that and willing that my recovery will be successful and I can get my life back on track. Well, not that it's been on track for a while, but you know, back into, well, hopefully back into my regular pattern with some new additions added in. Some new input would be nice into my day-to-day life. My lifestyle does definitely need some freshening up. So I might, like I said, I might learn a new language or do a course, or I might even travel somewhere. I don't know. Just gonna take each day as it comes, while also not taking each day for granted, and trusting no one, because that's some good advice right there. Bye. How do you turn off this thing? Oh yeah. Farewell.